Good morning and welcome to the Chamber's virtual learning opportunity, AlohaSafe, New Tools to Keep Hawaii Safe and Healthy, brought to you in partnership with AlohaSafe and Community by ALTRES. I'm Sherry Minor McNamara with the Chamber of Commerce Hawaii. Thank you so much for joining us for this important conversation and obviously topical issue. Hawaii is at a critical crossroads in reining in the coronavirus. While manual contact tracing has been a huge effort in protecting the community from the spread of COVID-19, health departments and organizations have been working diligently to create additional solutions on how we will bring the pandemic under control on our islands. Our special guest speakers today will provide greater guidance on the subject matter and next steps on how we as a community can work together with the use of digital contact tracing apps to slow the spread of COVID-19 while complementing other public health strategies such as social distancing, masks, testing, and manual contact tracing. Joining us this morning are Brandon Kurisu, President of AIO Digital, Michael Kamida, volunteer for Pathcheck Foundation, Barron Guss, President and CEO of ALTRES, Inc., and Madhu Lundquist, Director of Web Technologies of ALTRES. But before we get the program started and I turn things over to our esteemed panel, I wanted to go over a few housekeeping items. For all the attendees, please join the meeting in listen-only mode and keep your mics on mute. And in the interest of time, we will have Q&A at the very end of all presentations. Please feel free to submit questions during any of the presentations by clicking on the Q&A button on the bottom of your toolbar. And for those joining by phone, you can email your questions to Katie Arita Chang at karita-chang@cochawaii.org. Those questions will be reviewed at the end of all presentations. The webinar is being recorded and the video link along with the copies of the presentations will be emailed to attendees 1 to 2 business days after the session. And finally, we hope that you can join us next month for our 170th annual membership luncheon and virtual summit, Pushing Forward Together, presented by First Insurance Company of Hawaii. Our featured keynote speaker is Peter Schwartz, Senior Vice President and Chief Futures Officer of Salesforce, and other guest speakers. Visit our website, cochawaii.org, for more information. So before we get started with the program, we're interested in hearing from you on the following poll question. Have you or anyone you know participated in manual contact tracing? We'll give everyone a few moments to make their selections. Okay, let's see the results. That's a majority no, so it'll be interesting to hear from the speakers and what their thoughts and how we can make this easier for employers and businesses to implement this. So at this time, it's my pleasure to introduce Brandon Kurisu, President, AIO Digital, to share more about how the digital contact tracing apps can help Hawaii in the battle against COVID-19. Brandon?
Thank you, Sherry, and thanks for the opportunity to present to this group today. Let me just quickly share my screen. Okay, can you guys see that? Okay, so yes. Today we'll be talking about AlohaSafe, which is it's a suite of digital tools that we are working on to keep Hawaii safe. So just a quick background. Back in April, when the pandemic first started, we started working with the Department of Health, and we created a syndromic surveillance tool to try and crowdsource symptoms from the community so that we could get a better idea of how the virus was was spreading throughout the community. And through that, we developed a good working relationship with the Department of Health, specifically the DOC-D group, which is the Disease Outbreak Control Division, which is all of the epidemiologists and infectious disease specialists. And through that relationship, we created AlohaSafe. And around May is, I think around May, that's when we started talking about AlohaSafe and what digital tools we can create together. So, what is AlohaSafe? AlohaSafe is a public-private partnership with the Department of Health, as well as other supporters and volunteers from the community and the private sector as well. And through this partnership, we are rolling out several digital tools. The digital contact tracing tools on the left are developed in partnership and in collaboration with the Department of Health. And the screening and workplace access tools on the right are not affiliated with the Department of Health. So I just wanted to make that known. The AlohaSafe Alert app will be Hawaii's official digital contact tracing application. It's based on the Google Apple exposure notification, which Michael and I will talk a little bit more about later. The AlohaSafe Story is a patient memory aid tool based on GPS technology, and I won't spend too much time talking about that because the main application is the Alert app. And the screening and workplace tools, AlohaSafe Workplace is a more enterprise level workplace access solution. And ALTRES has their wellness tracker, which is a self-screening tool that Barron and his team will be talking about a little later. And we decided to team up with ALTRES and with the goal of getting as many businesses on board using these tools, to keep their employees and their customers safe. Because I think if we work together, we'll have a much broader impact. So. Before we get into things, one thing I wanted to really stress is that, Google and Apple, they're only allowing COVID-related tracing applications in their stores that are submitted by the Department of Health. And, this is to prevent, other rogue efforts out there that are trying to get their applications in the app stores, because we can't have 10 contact tracing apps out there that don't talk to each other. That won't work. There can only be one, and the Alert app is going to be it. So regardless of what you see about certain resolutions being passed or all of that, it really doesn't matter, because at the end of the day, the Department of Health is the only entity that can have their app in the App Store. Okay, so at a high level, I'll talk about AlohaSafe Alert, and Michael will talk about it in a little more detail. But really, the basis of this application is to let people know if they were exposed to an infected individual, so that they can take the necessary precautions and next steps. And as I mentioned, this application is using the Google Apple exposure notification, or GAIN, G-A-E-N. And I'm sure a lot of you know that GAIN is already embedded in the operating systems of your iPhone and your Android devices. And they say that that's like a third of the world's population. So the only way to access this protocol is through a key. And Google and Apple are only giving one key to the public health authority at the state or country level. So the Department of Health for Hawaii is the only entity that can get this key. And they have the key, and this AlohaSafe Alert is the app that's going to be using the key. This is just a high-level sort of process flow on how the app works. So it starts with the interaction. So Kimo and Lonnie, they both have the AlohaSafe Alert app running on their phone, and they're in a meeting. During that meeting, their devices are pinging each other. They're sending little transmitting sort of random keys to each other using Bluetooth technology. And these keys are measuring the strength of the signal, which Google and Apple are sort of using to infer the distance or how far they are from each other, as well as the length of time of the interaction. So, say Kimo, he's later tested and he's confirmed positive. The Department of Health contact tracer will reach out, contact Kimo for his usual contact tracing interview. And at that time, he'll say, I have the AlohaSafe Alert app running. The DOH contact tracer would then generate a 6-digit code that they will read off to the patient, to Kimo. And Kimo would open up his app, enter in the code, and submit his keys to the key server, to the Department of Health. And these are all random keys. They're not, there's no identifiable features or anything. So once the keys are at the key server, it's Kimo and Lonnie's interaction is being measured, I guess. And if it meets the minimum exposure notification criteria, then Lonnie would receive an alert on her phone saying, you may have been exposed to COVID, so please contact your primary care physician or get tested or isolate. It's up to the Department of Health on what they want that message to say. So, to summarize the GAIN app, all Apple and Android devices have the protocol in your operating system already. You need a key to access it. There's only one per state or country. It uses low energy Bluetooth technology, so it doesn't drain your battery. And users can opt in or opt out at any time, so you're not forced to use it. One thing I didn't mention is that GAIN does not track location. It's just the devices that you've been exposed to. Google and Apple frown upon combining GPS and Bluetooth technology in the same application because they feel that would be almost like true surveillance. So you have to keep it separate. Notifications are triggered only if minimum thresholds are met, and only the Department of Health can see this data. So this is just a very high-level list of some of the countries and states that have adopted GAIN. You can see Australia, Japan, UK, so big countries, and these are some of the states that have either an app in development or something is live in the app stores. The Association of Public Health Laboratories is working with Google, Apple, and Microsoft to create a national key server. So this would allow sort of cross interstate tracing, and this would be good for Hawaii, because you can see Nevada is on here as well. So all the Hawaii guys going to Vegas, they wouldn't need to download another app, and everybody would be talking to each other. Just really quick, I'll talk about this AlohaSafe story, which it's a patient memory aid tool, and it's meant just to jog the patient's memory. A lot of times, these guys have fevers and they can't remember where they've been. So this app is a tool that you just download it and kind of set it and forget it, and it's just logging your location every few minutes, latitude, longitude, and time on your device. And the only way it leaves your device is if you choose to share it with the contact tracer. So the contact tracer would receive the location data and pull it up in a map that sort of looks like this, where they see your past location history. And they'd walk the patient through their past location history, not really to see where they've been, but it's more to see if they were with anybody, to jog their memory. So, I've been with, so the contact tracer might say, okay, I see you went to Ala Moana a couple of days ago. Were you with anybody? And I say, yeah, that's right. I was with my cousin, and we had an hour-long car ride. And so they say, okay, well, give me your cousin's information. We need to reach out to him. So that's how this tool works.
Hey, Brandon, sorry,
yeah.
Your time is up. Could you wrap up?
Oh, sorry,
and,
okay.
No, it's okay, thanks.
Okay, so yeah, wrapping up, we have our workplace tool, and it's more enterprise level for larger organizations. Right now, we have it running at Central Pacific Bank. So all of their employees at all locations are using this tool. We found that for an organization like this, we needed to customize it a little bit to fit their workflow and operations in order for it to be effective and embraced by their employees. So, if you're interested in a demo of this, please let me know. Thank you.
Thanks, Brandon. The next speaker will be Michael Kamida, who will talk about how this works. You have to unmute yourself.
There we go. Hi, so I'm gonna talk about the digital contact tracing, or two of the digital contact tracing apps that we have. So contact tracing helps contain the spread of the virus and protect others in your community. Like, the basic idea here is that contact tracing is something that is worth participating in. But contact tracing has a few general challenges. The first is resourcing. It takes many contact tracers to control a pandemic. The second is speed. It takes time to call these cases, to conduct these interviews, and then to identify and call their contacts. And then there's a problem with completeness, because people have imperfect memory, and they can't identify strangers. Like, if I'm on the bus or if I'm sitting in a restaurant or something like that, I don't know the strangers around me, even though I may have been in close contact with them. So as Brandon said, with AlohaSafe, we've partnered with the Department of Health to develop two apps, the first being AlohaSafe Alert, which uses that Google Apple Exposure Notifications API to provide alerts to people to let them know if they may have been exposed to someone diagnosed with COVID-19. And then the second is that AlohaSafe Story, which is the private log of your location history, basically to help you remember where you've been, so that we're not using mobile phone tracking, and you can track yourself and then share that with the government contact tracers when you need to. And all of these apps use privacy by design. There's a big focus, or privacy is in mind from the design stage. And what that means is basically there's three main points. The first is that all of these apps are user controlled. They require explicit consent from the user to start working, and then again consent to start sending data off and to start sharing. And it can be turned off by the user at any time. The second is that identifiable information is not collected, and that means that there's nothing that's being shared with Google or Apple, and there's nothing that can be shared with other third-party groups. And then again, this is COVID-19 focused. It's really only for public health authorities, and the data and all of this stuff is not being monetized. So really quickly, here's a comic about how exposure notifications work. Give me 1 second. I'm going to pause here for a second, but really Brandon sort of discussed at a high level what happens. Alice sits next to Bob. They exchange these random identifiers. And then if Alice is later diagnosed, she can share the things that she said, and Bob's phone can check to see if he saw any of those things, and that's how he'll know to get that exposure notification. So the big advantage to exposure notifications is that it expands the reach of traditional contact tracing and really lets you rapidly notify these unknown contacts. You can see sort of here, the idea here is that Bob has, or sorry, the names have changed here, but Bob has COVID-19, hasn't been diagnosed yet, and throughout his day, he might see 3 different groups of people. He might see his roommate, he might have a conversation with a stranger at a shop, and then he might sit with a group of complete strangers on a bus. And so with manual contact tracing, it's really easy for Bob to say, all right, this is my roommate, this is someone that I see. For someone that they had a conversation with in a cafe or a restaurant, maybe if the contact tracer investigators have a bunch of time and they're able to go back to the restaurant and contact the restaurant and see who the other customers are or whatever, then they may be able to identify those people. But for complete strangers on the bus or that they passed in a shop or something like that, like there's no way for them to really be identified. And so that's where the contact tracing app is most useful. So let me move on. So here's a sort of high level picture of what the exposure notification system looks like. Over here, you have the apps that are exchanging those non-identifiable Bluetooth beacons. And then in the event that they are testing positive, the contact tracer and the verification system is going to allow that patient to upload their keys to this national key server, as Brandon said, hosted by APHL. So if you're traveling interstate and those other states are on this national key server, you'll also receive notifications from them. And then once the exposed person receives the notification in their app, then they'll get guidance from the Department of Health as to what to do next and hopefully feed efficiently into the contact tracing system. So importantly here is that these exposure notification apps can slow the spread at any level of adoption. So there was an Oxford study that often gets misquoted. And if you actually read that study, it says that if 80% of all smartphone users, i.e. 56% of the overall population, were to download an app and be using it, that would be enough to suppress the pandemic on its own without any other form of intervention. And so this study was like, all right, if we're not doing manual contact tracing, if there's no vaccine, if you're not doing additional testing and stuff like that, about 60% of the population using the app would be enough by itself. But no one is suggesting that we only do it by itself. It's part of a whole suite of tools and solutions that we're looking for. That study actually found that for every 2 app users, you can basically avoid 1 infection. And then that combined with other measures, as little as 15% usage can reduce infections by 15% and deaths by 11%. So from there, I'm going to actually show you what this looks like. So let me sort of launch this app. So this is what happens when you first start running the app. You get to say, welcome to AlohaSafe Alert, and it tells you what the app is doing. Together, we can slow the spread of COVID-19. Your phone remembers the other devices it meets, but it won't identify you to anyone. Your privacy is protected because no personally identifiable information ever leaves your phone. If you're exposed, app is going to notify you that you may have been exposed to COVID-19. And then if you are positive with the app, you can contribute your data and help slow the spread of COVID-19 and get advice directly from the health department. And then how we protect your privacy, as we talked about earlier, when you turn on proximity tracing, your phone is going to broadcast these frequently changing random numbers. They change every 10 to 20 minutes. Other phones will swap the IDs with you. if you test positive, you can share your health status and submit those keys. And then the phone is going to periodically ping that server to look for any of those uploaded positive keys and see if there's any matches. And then if you have a match, you're going to get the alert. So after you do all that, you would have to activate proximity tracing. I'm going to hit no thanks here because this is a virtual phone and it doesn't really work right there, but on your devices, we encourage you to actually enable it. So this is the home screen for the app. So the idea here is that you would just have this app running in the background on your phone. Because it's using that Google Apple exposure notifications Bluetooth API, it's running at the OS level in the background. So there's not going to be a big impact on your battery life. In the event that you test positive, you would click report positive test result. Maybe it's not going to let me do that. But anyways, you would click report positive test result, and that would, there we go. I have to enable notifications to continue. But anyways, you would do this, and then you would be had I been able to enable exposure notifications, you would have been prompted to enter a one-time passcode. The idea here is that the Department of Health is going to be able to verify only people who've actually tested positive, and they're going to be giving patients a 8-digit code or a one-time PIN, similar to when you're trying to log into your bank or something like that. And the patient will come in here and enter that 8-digit PIN into the app. After they do that, they will upload their keys, and back on another patient, they will end up receiving a notification like this that says someone near you recently has been diagnosed with COVID-19. So on their app, when they're at the home screen, they'll be able to go to this section after they've received that notification, and they're going to get this notification of a possible COVID-19 exposure. And then in the interest of anonymity, you're not even given the precise time or place or anything like that. It just says, you know, a rough estimate of when you may have been tested positive. And then you're going to get some guidance from the health department about what you should do, and then be able to follow this link to get additional next steps from the health department, you know, information about testing sites and stuff like that. In conclusion, really, we want you to add your phone to the fight, and that, you know, participating in contact tracing by running these apps in the background of your phone is really best practices for being able to contribute to contact tracing efforts. And we can really do this without sacrificing privacy. And that's it from me.
Great, thanks so much, Michael. Okay, now it's my pleasure to introduce Barron, Guss, and Madhu Lundquist to share more about the features of AlohaSafe Wellness Tracker and how it will help businesses curb the spread of COVID-19 in the workplace. Barron? The famous three words, you're on mute.
You know, my wife wishes she had a mute button for me. Maybe we can maybe we can bring these tools home and give them. This is Guss. I'm sure, Sherry, you would be a fan favorite at that point. Anyway, want to share with a little bit today about the AlohaSafe Wellness Tracker, and I want to thank Michael and Brandon for giving even me a better understanding of what tracing looks like and feels like, and the concept of anonymity, because I think that's pretty important to get people to understand. The wellness tracker is based on a little bit different theory, and I think everybody on this call, we all have one thing very much in common, and that is we've all grown extremely frustrated with the effects of COVID-19 and its ability not only to change our daily lives, but the effect it's had on our local economies, our national economies. And I think one thing has really come about now that we have all kind of settled in. Each one of us is going to have to really do our part in order to simply stop this virus in its tracks. And I think we all hear about the ideas that we must wear a mask or we must wash our hands. And that's all great. But what can we do individually, if you will, to stop the effect? And so there's a concept out there that's called self-screening. And it's really the most widely accepted and non-controversial method to create a shift in the thinking around virus containment. And the idea is pretty simple. Each day, each of us will individually self-screen. And it's based on the concept that I'm taking responsibility every day, personally. How do I feel today? Do I have a fever? Is there anybody I came in contact with yesterday? Or did I invite my family member from the mainland and did they self-quarantine in my home? Is there a possibility that I could be a carrier of the virus? And from there, I make this conscious decision to either, I think I'm going to stay home today. I don't feel so well. Or you know what? I'm going to head out in the world and start my day. So using these principles, ALTRES created this self-screening software to make the process very simple and easy. And I'm just going to go straight into it. We created the software, as many people know, we are a human resources administration company, and we have a suite of technology called HR Symphony. HR Symphony is the software we use internally for us to communicate with our clients and our clients to communicate with their employees. So we introduced a self-screening feature into HR Symphony, and it was quickly adopted, and something popped out of it that actually, when you see it, it starts to give you chills. And what happened, and I mean it, what happened is that when we first saw the software start to work and we had 10 people self-identify that I'm a potential carrier of the virus, and we get the numbers start escalating. And I think they kind of tracked what was going on in our community a little bit. As you know, we had a pretty flat curve in the beginning, and then we had a hockey stick that started to climb out. And we had days where we had 25 people that self-proclaimed or self-identified, as the slide says, that they possibly were a potential carrier. And therefore, the software would tell them to just stay home or contact their supervisor. But at the time when we released the software, we had over 400 people self-identify. And when you start to understand the butterfly effect of those 400 people, not all of them had COVID-19, but a certain percentage did. And if we could keep those people home, if we could keep them out of the community, we are definitely meeting our objective. So once we saw success with our internal clients, it seemed pretty logical that we needed to take this tool out to the community. And hence we needed to build a standalone platform, and that's exactly what we did. So rather than talk about it too much, I'm going to run this video for you. I'm just as kludgy as an operator as I am in turning off the microphone, so bear with me, and we'll see if we can run it for you.
For Hawaii, there's nothing more important than reducing the spread of COVID-19, and for employers, it starts in the workplace. Having employees self-screen for potential symptoms before coming to work is the first step in managing the spread of COVID-19. The ALTRES Foundation, in collaboration with HR Symphony, is providing as a courtesy to businesses statewide its COVID-19 self-screening application, wellnesstracker.com. Here's how it works. First, register your company at wellnesstracker.com. Then, you can easily input your employees or save time by importing them all with the provided template. Next, set up your screening criteria. You can start with the sample questions provided or create your own specifically for your business. You further specify additional guidelines such as supervisors, employee schedules, and notification preferences. You can even upload your business's logo to keep company culture top of mind. And you can broadcast a company-wide message to all your employees for important announcements. Before each shift, your employees receive a notification text or email with a link that directs them to the self-screening survey. Upon completion, they're directed to proceed to work or stay home and await further instruction. Simultaneously, the software notifies the manager of the results. Because of Wellness Tracker's powerful dashboard reporting, you'll have real-time access to important information to manage your COVID-19 defense strategy. Signing up is simple. It doesn't require an app or any additional downloads. You just need an email address to get started. And here's the best part, there's no cost. It's simply ALTRES' way of helping restart the economy and keep Hawaii safe. Visit wellnesstracker.com to learn more and sign up today.
Okay, Barron, I'm gonna say these 3 words again to you. You're on mute.
I know, I'm trying my best to impress the world. Anyway, I have Madhu Lundquist with me. Madhu is our Director of Web Technologies, and he's going to give us more of a nut and bolt overview of how a business could get enrolled into the Wellness Tracker. So I will stop my sharing and Madhu, take it away.
All right. Hi, everybody. Thank you, Barron. All right. So I'm going to just do a brief overview here of how you would set up your company on Wellness Tracker. So let's share my screen. All right. Does everyone, do you see that? All right. Okay. So you go to wellnesstracker.com and you click Get Started. The whole Wellness Tracker is built mobile first, so it will work on a mobile device or on a desktop browser. So you can set this up for your company from your couch or from your desk. So we'll come in here and we'll get a company going. All right. So once you've entered your company details, you'll review our terms and conditions. If you agree with them, you click I agree. All right, so now you're on the dashboard. So Wellness Tracker is entirely self-service. We've designed this so you can do everything without any assistance. However, if you do need help from us, you can always click over here to the help icon and reach out to the HR Symphony web support team, who are also providing support for Wellness Tracker. So now that you're on the dashboard, you'll see that we have various notices up here. These are to help you further set up your account. In addition, if you want to personalize the experience for your employees, you can come over here to Set Up Company and pick a logo. All right, so now we've got our nice Maui Farms logo up there. The next step is to add screening questions. So you click the Add Screening Questions link. All right, so once you're on the screening questions screen, you'll see there's 2 choices, add a question or add sample questions. Our risk, safety, legal, and HR teams have put together compliant questions that you can select from that follow the CDC guidelines. So we'll pick a few of these. All right. In addition, you can add your own company's specific questions by clicking this. All right. So once you have your questions set up, then you want to set up your shifts. Now your shifts are used to indicate the time that your notifications are sent each day. So, you'll have, some companies will have employees that work in the morning, some in the afternoon, some have varied schedules. So for demo purposes today, we'll set up a single shift. And we'll have it occur Monday through Friday. All right, now we have our shift set up. The last step before your employees receive their notifications, their self-screening notifications, is to add your employees. So we'll click over here to employees. You can add your employees one at a time, or for ease of entry, you can click Import Employees. You can download our template, All right, I've already set up an import file for us, so we'll hit choose file. We'll pick our employees, upload. All right, now we've got all of our employees in the system. Each of your employees, if they have an email or a phone number, they will receive a email or a text message to verify that address and also opt in to receive their notifications. And then before the employee is scheduled to work, they'll receive their text message or the email notifying them to complete the wellness check. They can also log in to their account on Wellness Tracker and click this button on the dashboard that says Complete Wellness Check. So we'll use that today to show you what the survey looks like. All right, so this is the desktop experience. Most users are going to receive this on their mobile device. So it will look like this. So the first question is, are you scheduled to work today? You can also customize that to fit your business needs. In this case, we are going to choose no for all of these questions, basically indicating that it's okay for us to come to work today. So after I've submitted it, I now get this response screen, basically with the green check, telling me, great, see you at work. The employee can click that same link in their text message or email or from the dashboard at any time that day to pull up this screen again. So if you're in a type of environment where you want your employees to show you a phone when they arrive, or show you their badge basically when they arrive, you can do that. Also, if you have a health concern or if it results in a health concern, your supervisor will be notified immediately, and you're also told to follow up with them. So that looks something like this. All right, so this would be if you're told to stay home. Let's see, so in addition, all the results of the health surveys are all stored here in the daily log. So a supervisor or an HR admin or whoever you designate as having permission to view this data can come in here at any time and see the survey results for a given day or for a specific employee. Let's say that there was a health concern and they were told to contact their manager. They contacted their manager. Manager spoke with them, learned that maybe it was not enough of a concern that they would need to stay home. So they can come in here and add a note explaining, the reason that they were allowed to come to work, or vice versa. This can also be used if the employee had a health concern and needs to stay out of the office for 2 weeks. You can notate that here. Let's see. So the other features we have are the broadcast feature. So imagine you have an exposure in the workplace and you need to quickly notify all of your staff to stay home temporarily while cleaning is completed. You can use the broadcast feature. So you click right here, and in this case, I have no verified employees yet because I haven't clicked the verification link. But basically, you'll see a screen where you can put in your message to them, and they'll receive a email and or text message with that important information. And then finally, if you find Wellness Tracker of value, you can share it with other business owners using the share feature. And that is basically it. I guess one thing I did miss on the dashboard here on the right side, we've compiled a list of various COVID-19 resources for your business. So we have a link over here to the AlohaSafe product, which you just saw, and then also CDC guidelines, some of the Simplicity HR information we've put together, and then the State of Hawaii resources. And that's pretty much it. Barron, anything that I missed that you wanted to?
No, I think you did a great job. And one thing I want to talk about briefly in regard to Wellness Tracker, I think it's important to understand that we are sending daily texts out to employees in their cell phone. They do, of course, receive emails as well simultaneously. And the managers are also getting notifications when an employee self-declares that they can't come to work today. So we've tried to build the features as useful as possible. And you know, we first deployed this with our own customers, and now we've put it to the outside world. I think we have about 170 businesses that have enrolled now in the last 2 weeks. It's definitely been a quiet, soft launch. Probably today is the first time we've gone what I would call kind of public on this. And I think very soon you're going to hear some widespread adoption statewide. We have a lot of private businesses reaching out or reaching into us, asking about certain things. Madhu, if you would allow me to take over, I'm going to share something else too with everyone.
Yeah. All right.
Or I'm going to try. So the next thing that I wanted to show everybody was based on the feedback from our clients and the users. The next thing that came up for us and said, this is really great. We have a way to start, you know, protecting our workplace and creating a COVID-free environment. And it starts with our people, it starts home. What can we do in regard to guests we invite into our workplace? How can we screen them? And so we did two things. And one of the things we have, if you imagine if you had a haircutting salon and you wanted to invite somebody in, you can send them a link and screen them. Or what we've created is this QR code generator and a poster. And you'll see this feature probably released in the next 3 or 4 days into Wellness Tracker, where you'll be able to print out this poster that you see on the left-hand side of the screen that informs the person that's coming into the business that your business does use wellness screening. And what it also does, and imagine a restaurant, and I think we've all seen it now, we go into a place and they are taking our temperature. This allows people to screen a little bit more. And for a restaurant, and you've seen it again, you will self-enter your name, your phone number, how many guests are with you coming into the restaurant. And the host or hostess as well has the ability to go into Wellness Tracker and do a manual entry for those guests who maybe don't have a smartphone. So, and in the event of an exposure, this is a secure and private database that your entity, your business will control. And if contact tracing becomes necessary, this data then can be handed over to the Department of Health tracers as well. So we're trying to really come up with an ecosystem for this information based on self-screening. I think combined with the AlohaSafe initiative, we are putting forth enough tools to really allow the business community to put the restart, the safe restart, into their own hands. So that's where we are. The other aspect that I mentioned, and you've heard, this is a gift to the community from you know, the AlohaSafe initiative, Wellness Tracker from the ALTRES Foundation. There's a lot of ongoing costs for both groups. In our particular case, we have a lot of programming horsepower behind this. It's very secure. It sits up at Amazon. There's a lot of costs. We are covering all the texting out of our own pocket, and we are giving this as a grant from the ALTRES Foundation to all the people in Hawaii. So please share this with everyone. We will not monetize it. We will not charge anyone for this now or in the future. And we will keep it up and running as long as necessary to kick, you know, COVID-19 to the curb. So thank you, everyone. If you need more information, you can go to wellnesstracker.com and or we are alohasafe.org, and those links are there as you can see them. So thanks very much, and everyone, for your time, and thank you.
Great. Thank you so much, Barron, and thank you for this free service. It's amazing how you, as well as everyone on this panel, have acted quickly and using technology and to ensure that we can get back on track in a safe and healthy way. So really appreciate all that you're doing. We do have a few questions. So whoever wants to chime in, please go ahead. The first one is, for a workplace, what size companies would benefit the most from this tool?
So I'll chime in. I can say that maybe if your organization has a complicated workflow, or you feel like you might require some type of customization, or if you have many, locations or departments, or layers of managers, then maybe workplace might be a tool to explore. But I'd say, you could reach out to either Barron or myself, and we could, point you in the right direction. If Wellness Tracker would be a better tool, or if the workplace would be a better fit for your business.
Maybe just pop in here. I think the idea is self-screening is something that works for everyone. I can tell you, every one of us individually. So that means a company of 2 or 3 employees. It could even be a single sole proprietor. I personally set up my own demo account on Wellness Tracker. And I get reminded every day at 6:30 in the morning to ask myself, how do I feel? I do have the little temperature gun on the vanity in my bathroom. I always just take my temperature every day. It's just that constant reminder that we need to take responsibility. So I think it's anyone, any entity, from 1 employee to several hundred. We do have a number of businesses outside of HR Symphony customers today with several hundred employees. We have 1 entity up and running right now with 800 employees. So, and as Brandon mentioned, our technology, as well as the AIO technology, it handles multiple locations. It handles manager scenarios and flow charts and notifications. So to Brandon's point, he has a really great workflow product that meets the needs of complex organizations. Our product, we've tried to put as many features in it that will allow somebody to self-implement and self-set up. But if you need some custom implementation, Brandon can help, or if you have a specific need, we all in the software business only get better with client feedback, and our products evolve with client feedback. So if you have something you need that you think makes sense for all businesses, let us know. Sorry for the long-winded answers. So.
No worries. Okay, the next question is, when will AlohaSafe alert become available? I've already downloaded AlohaSafe story.
So I'd say, right now we're going through extensive testing with the Department of Health, and also getting new leadership there up to speed and caught up with everything. So, I would say sometime after the election, because we want to maximize, our outreach strategies and drive adoption of the application.
Okay. Where is the data stored? Does an employer download the file daily, and so confidentiality is kept?
Madhu, why don't you chime in here?
Yeah, so with Wellness Tracker, so yeah, I'm not sure what that question was, Wellness Tracker or AlohaSafe. So I'll speak just about Wellness Tracker here. So our data, we store the data on our servers, but they're at AWS, and we follow best practices with data encryption and whatnot. So the data is encrypted between the user and our servers, and also within our servers themselves and on the server. So as far as confidentiality goes, it's protected basically by your login credentials. So if you keep your login credentials safe, your data will remain safe. But we store it, it's stored ongoing, so you can come back at any point in time and pull whatever reports you need to pull. Hope hopefully that answers that.
Okay. We have looked at the ALTRES wellness tracker, but have not adopted it yet. Half of our staff work from home. We also have laborers that are not comfortable using technology and therefore not likely to do the screening regularly. How do you recommend we implement this?
Yeah, I can answer that one too. So we have a on-demand feature as well. So what I demoed today was where you receive notifications at a specified time every day. You can also configure it so your staff don't receive a notification and instead can come onto the system at any time and complete their wellness check. So that works really well for people that have varied schedules. If someone, and also if they don't have a smartphone, if they just have access to some sort of device that they can access the internet from, they can complete this. So if they have an iPad or a laptop or whatnot, I mean, basically you need some sort of device to complete your wellness check. I guess you could set up even maybe a kiosk at your business work site for people to complete that, but that comes with other risks because they're all touching the same surfaces.
Well, the idea of self-screening is also for people to self-screen at home before they even go out into the community or into the workplace. I think a lot of people talk about access to the workplace and then being screened at the workplace. But the idea is to be more prophylactic than that. And that's what self-screening is all about. We didn't invent it. We're just trying to implement it in an efficient way for everyone to do it. What came to mind is if someone at an organization feels that is their workforce, you could theoretically look for a manifest of all the people that are scheduled to work for the day and do a phone tree out and at least ask the questions. That may be a way. Arduous, burdensome, but don't have all the solutions, but we're trying.
Well, and actually that scenario Barron just described, our upcoming QR code scanning feature will actually be of use there as well, because they don't have to scan the QR code. Like you described, you could have like the hostess at a restaurant complete a health survey for them manually. So they could use that same concept. They could use our system they could call up the employees and then manually enter them into the system for their health screens.
Okay, going back to the data, how long is the data kept in file and how do they access historical data? And can it be exported to Excel?
We do not yet have an export feature, but that is on our roadmap. As far as how long the data is held, at this point it is indefinite, but we will at some point here probably implement some sort of data retention limit. So, but it'll at least be available for a year. Okay,
and Brandon, this is for you. This is our final question as we have to wrap up. You mentioned after the election. So what is your outreach strategy?
So right now we're working with the Department of Health Communications Department, as well as some other contributors from the private sector to come up with our strategy. But Google has also generously offered a lot of marketing support and credits, leveraging their platforms. So from like Google Ads to YouTube promotion to even homepage placement. And so we're just kind of exploring all of these options and coming up with a strategy to execute and drive adoption.
Okay. All right. Well, we're just about coming up at the hour. So I just again wanted to thank all of our panelists for this really informative, valuable information. This will go a long way in protecting our employees, as well as our customers, as well as our communities and families. So thank you for all the hard work that you're doing, and we look forward to further collaboration and partnerships. And mahalo to our attendees for attending. And again, our annual luncheon is on November 6th. So please go to our website to get more information, and hopefully you can join us virtually. Thank you. Mahalo and have a wonderful rest of the day.